where I was one of the recipients for the NGL Award. That entire night, instead of me being excited to be traveling with my peers to Canada that August, I was worried if I would have a panic attack in the midst of it all. What was meant to be one of the greatest experiences in my young life, I thought my mental health had ruined for me. Why was I the one having to go through so much? I didn't have this planned in my life at all. I never thought about having to deal with mental illness. Then I stopped and thought about how people are going through so much worse than I am. I have the control to beat this. That's when it started again, fixing myself to be better. I continued my sessions with Dr. Hawkins, and through this, I started writing. Writing has helped me through so many of my darkest times. Just the thoughts of transferring my thoughts on paper was liberating. Before I knew it, my trip to Canada came around, and it was one of the best experiences I've ever had. And I'm happy to say that I did not miss out on it. I graduated from high school with honors, and I started college. Now, I was doing all of my writing, reading, working out, but then I discovered pageantry. I saw an ad advertising my school for Miss Teen Cayman Islands. I went home and spoke with my parents, and before I knew it, I was a contestant in Miss Teen Cayman Islands 2016. That was hands down the best summer of my life. Not only did I make great friends in the process, but it was something to keep my mind off of everything that I went and was going through. Because of this pageant, I came up with the platform of raising awareness for teens who struggle with anxiety and depression. I advocated that throughout that entire pageant experience. I even made a short video on what I was going through for my talent, and in the end, I was named second runner-up, and this is my first. I bet you thought it stopped there with the pageantry, but nope, I did 3 more. And in all 3, I was placed in the top 2. I am currently the title holder of the Cayman Islands Imperial Beauties Teen title, and I recently traveled to Orlando, Florida for the World Imperial Beauties pageant, where I placed first runner-up in my division, out of a lot of awesome girls. Pageants have helped me in so many ways and gave me this platform to raise awareness for such a taboo topic amongst us here, especially in the Cayman Islands. I couldn't do any of this without the support of my family, my doctors, and friends. It's because of them why I was able to overcome such a difficult obstacle in my life. Now I feel I'm at a good place, especially because I've learned to love myself and to go for whatever it is that I set my mind to. And for anyone who is suffering in silence, please talk to someone, because there is nothing wrong in opening up to someone who is willing to help you. For those who are too afraid to speak out, let me be your voice in your place of silence. I will speak up for you to let me know that you are not alone and that I hear you loud and clear. I'd never forget the day I walked out of my house and I inhaled a fresh breeze, and I felt like my old self for the first time in a long time. But the reality is, I will never be the old Jada I was, because the Jada I am now has a story to tell and a great result at the end of it. I have the faded scars on my forearm to prove that it does get better and will. I don't know what else is going to happen or what else is going to get thrown at me in life, but what I can say is, bring it on. Now I'll say, my next chapter is being written and almost about ready for publication.
That was absolutely fantastic. Jada, thank you so much for sharing your story with us. I'm sure that it's touched everyone in the room, and we all wait with bated breath to read the next chapter when you're ready to share it with us. We've now reached chapter 6, which is going to look at a missing link, child and adolescent urgent mental health services. And I think Lizette made mention of this a bit earlier in the panel discussion. And our speaker for this is going to be Dr. Marc Lockhart, who is the chairman of the Mental Health Commission. You heard his bio earlier, but I'm going to read it again because it it bears repeating. Dr. Lockhart is a board-certified psychiatrist, and he completed his adult psychiatry residency at Wayne State University, Detroit Medical Center. He's been a practicing psychiatrist in the Cayman Islands for over 18 years, and is currently the director of the inpatient psychiatry unit at the Health Services Authority. He is also the medical director of BHAC, which is the Behavioral Health Associates of Cayman, and the current chairman of the Mental Health Commission. An area of focus for the commission is finalizing the development of the long-term care psychiatric facility for the Cayman Islands. And actually, I should just clarify, the ministry is hoping to start the project this year, and it will take 12 to 18 months to complete it. So we're hoping to have groundbreaking in April, May, hopefully April, and then completion at the end of 2020. So we're very, very excited about it. Dr. Lockhart received the honor of Emerging Pioneer for Health Services at National Heroes Day in 2015. Ladies and gentlemen, please welcome back to the podium Dr. Marc Lockhart.
Thank you very much. It's been a long day, interesting day, and I want to give you all the accolades for everyone to sit through everything today, and that shows their commitment. A fantastic, fantastic program, and I have some slides prepared. I'm going to touch on that, but there's just so much information that I really want to draw things together from all the fantastic speakers. I want to give them all a hand, all that information. Ladies and gentlemen, Alex Panton lives. Alex lives in people like Jada. And many others who we treat. When I say that he lives, we're not encouraging anyone to feel that they have to get to the point where they take their lives. He lives in those who are overcoming their limits. We're going to talk today about the current state of emergency care in our islands. We're going to talk a little bit about understanding youth and adolescents, so you got a lot of information today. We have all the stats about that. A few challenges and approaches, and then we're going to talk about some recommendations, which a lot of you brought up, and a lot of this we had covered. I always like to start with the definition of mental health. Mental health is not just the absence of a disorder, but it is a state of well-being, as it says there, where every individual realizes their own potential, that they can cope with the normal stresses of life, and that they can make a contribution to their community. That resonates with everything everyone has said today, that all the speakers spoke about. What I would like to highlight going forward also, we'll talk a little bit about that, is not just the stats, but what can each and every one of you do when you leave here today? And several of the speakers spoke about it. Terry gave a wonderful process of us meditating and reflecting on feelings. And I want to build on that by saying I want us to go out there today and tomorrow and next week and talk to one or two other people about some of the things we heard today so that they can share it. That's how we break down barriers. Where we are right now, and you've heard the stats, is that we're not in the best place. We're not where we should be from an emergency standpoint. It's important to note that the majority of cases that show up in the emergency room at the hospital, which is the primary hub for treating anyone with any type of emergency, medical emergency, the Cayman Islands. The primary reasons that people go are due to depression and anxiety, stress reactions, interpersonal type relationships, challenges at work, difficulty with home life. The majority of people are not going into the emergency room for psychiatric issues that are based on schizophrenia or the major diagnoses. It's primarily interpersonal, family-type relations. One of the statistics that Dr. Lam highlighted was that 38% of the students in the survey had aggression at home. That was the largest place, not school, but it was at home. That's what we're seeing in the emergency room settings. So if you look at the statistics, when we look at substance use disorders and all the other psychoses and bipolar disorders and so on, if you look at the numbers over time, they're second and third compared to what we call adjustment or other interpersonal type issues. That creates a bit of a challenge. And the challenge is that the way that we have our process set up is still based on our small town formulation that we had 15 and 20 years ago. And what I mean by that is we have psychiatrists that are on call for all mental health issues. Whether that is a social issue, whether it's a young child that has an issue at school or being bullied, what happens is that the psychiatrist is called in the emergency room setting. There are benefits and risks to that, and that it can over-medicalize and stigmatize a child or a young person when they would be best dealt with by a social worker, a counselor, a psychologist, or another trained type of therapist. That's one major issue that we face with the current state of emergency care for youth. A second major challenge is the actual facility. An emergency room is designed to manage physical medical problems. The setup, the layout, the staffing, the arrangement, you enter, your blood pressure and vitals are taken. It's set up to treat physical type ailments. It actually pushes away those with emotional issues. It's a very cold, uncaring from the outset appearance, but it's very caring. It's that the nurses and the staff there are dealing and triaging emergency issues, and so their energy level and their time that they have to spend consoling, sitting with somebody, listening to them, talking with them is limited, even more so when it's a child. These are stats that we saw today, just a few of them that I mentioned, that were mentioned to us, that you had heard today. We have increasing numbers of youth and adolescents with challenges. We saw the stats today. We have statistics from the Health Services Authority that are showing increasing numbers of young people being admitted for suicide attempt. And that's in that 5% that Dr. Lam identified. It's important to note also that the stats that you heard were done by young people attending school. The last Cayman Island statistics that I looked at highlighted that approximately 69.9 or 70% of school-age young people were in schools. So addressing the question that was, to some extent, that was asked earlier, we have about 30% of school-age students that are not in formal school settings. Some of those young people are schooled at home, and many of them are not in any school. So we have a 30% piece of the pie that's out there that we don't know what's going on with them. And I can tell you that previous studies and data in other jurisdictions highlight the fact that those that are not in a school setting are generally functioning at a lower level in many of the parameters that we talk about. So the numbers that we saw today, as dramatic as they are still a snapshot of what's going on. The numbers are probably even a little bit worse when we look at things. There are many contributing factors to the stressors that young people are going through. And I think one fallacy that we need to break down is this old belief and statement that old people like myself say, that, you know, well, back in the day when I was a kid, it was much tougher. I walked how many miles to school, and I had to do this without lights, and I had to do that. And what are these kids talking about today? No, the world is harder today. It is. There are more challenges. I didn't have anybody bullying me because I was, you know, too tall and skinny when I got home. The bullying stopped. I could shut that out. I could say that I had a stomachache the next day and not go to school, and at least I had a mental health day. That doesn't happen anymore. Interestingly enough, Alex Panton was bullied quite a bit. And some of that bullying continued also on social media and technology. It's a double-edged sword. It's been our process as human beings to use technology, machines, steam engines, electricity to progress. The automobile was a fantastic invention that gave us the ability to cross large continents. But it also has the consequence of causing serious motor vehicle accidents, and probably the single most item that causes the most trauma, physical trauma in the world. I would propose, based on information that we see and have reviewed, that the cell phone that we're all carrying is a wonderful instrument, but it is also a tether. It is also a two-way communication vehicle to the rest of the world. And that's the danger for our young children. That technology is a major factor. Brain maturity that we all spoke about in different levels is another major factor. That the young brain is different from ours. And while new research is showing that there is a concept of neuroplasticity and that the brain, we can learn. Another fallacy is that old dogs can't learn new tricks. That's not true. The old dog just takes longer. Right? But we can learn. The young brain, though, it's a sponge. And that's the beauty. That's how nature has created things so that young brain can learn and develop and be able to survive. But that sponge sucks up both positive and negative influences. That sponge also sucks up any type of chemical that it takes in, and it causes more harm and more changes to the brain in the younger person than it does in the older adult. It's important to know also that vulnerabilities don't necessarily affect all youth the same way. So there are a lot of studies that show, for example, there's great work that's being done at the University of Miami by one of their psychologists on trauma. And I looked at some of what they did was they studied the aftermath of all the major hurricanes over the last 4 or 5 years. And they went to the different islands that have suffered hurricanes and studied the youth population in terms of how they responded to trauma and adverse events. What they found was that 2/3 of the young people that presented with traumatized symptoms responded very well 8 to 10 months after and were doing well. What did they respond to? They responded to time. Adults spending time with them, providing safety, addressing their concerns about uncertainty in the future, and being with them. And when I say being with them, we think many times, what do we do with the young person? We have to take them out to lunch, or we have to go to the football game with them. You can just sit in the living room. You can cook. You can talk. You can let them play a game. You can just sit with them. You can lie down and not say anything. Another thing we need to appreciate with young people is that, remember, all of us are born with 2 ears and 1 mouth. Listening is a powerful tool. Many times we have the temptation or the feeling that we need to do something or say something. And many times what I've seen, not just in research and in the literature, but in over 22, 23 years of seeing people and interacting with people on a daily basis, is that listening can be the most powerful intervention that we make, especially with young people. This is just some little age group breakdown, and these are just figures for the HSA. So these are not even including the other stats that we saw. And basically what it's just showing is that in the age groups, and this is just 2016 to last year, 2018, we're seeing increases in the 16 to 19. And if you put the 19 and under, you'll see the numbers. And these are just numbers of young people that have been seen just in the outpatient and emergency room at the HSA. Quite a few when you look at the numbers. In terms of looking at developmental disorders, autism, ADHD, those numbers are also going up. And again, these are just figures for one provider in the Cayman Islands. Understanding youth and adolescents, we've done a lot, we've spoken a lot today about that. 50% of diagnosed mental illnesses in adults, when we look at retrospective histories taken from patients, half of all the cases had their origin by age 14. 75% by age 24 or 25. There's been an average of 10 years between the start of symptoms and interventions. So we need to really be careful about that when we think of these stats today. It's one thing for somebody to confidentially share something on a survey, and it's another thing for them to actually open up to an adult and talk about that. And it's another thing for them to take that step to actually get care. And what we're showing is that both here and other universal stats are showing that it's about 10 years from the start of symptoms before somebody actually seeks treatment. Suicide is now the second leading cause of death for ages 10 to 24. It's ironic that the last time I used this slide, it was number 3. Suicide is increasing around the world. This morning, very early on BBC, there was an in-depth program on suicide and the increase. We have many major countries around the world that have zero approach to addressing it. It is a worldwide crisis. It's a public health crisis worldwide when we talk about mental health in general, but even more specifically the youth. So while we do have our challenges, and they are major, again, I want to compliment all of us for being here and realizing that we have to address it. We've spoken about brain changes. We can go in depth in terms of proving the point that the brain is developing. The adolescent brain is a very active instrument, and it's a brain that seeks thrills and challenges, and that's part of the benefit. But that same brain can lead them to danger. And so that's part of the challenge that we have. As Terry had mentioned and others, the brain isn't completely developed until we're in our mid-20s or so, and even then, there can be changes over time, but it's slower. There are some differences between child and adolescent problems and even how they manifest. And it's important to know that, I think it was Dr. Brown's talk, which is very interesting, and we look many times at symptoms. Parents, families, even clinicians among ourselves talk about the different symptoms and presentations. And it's very important because that helps us with a diagnosis, and for the most part, a diagnosis then directs and gives us a way of treating the person in front of us. And that sounds obvious. But I'll tell you, as a psychiatrist, we have to be careful also about holding fast to our checkbox type diagnoses. The state of our science is not in a place where we can give 100% correct diagnosis as to whether somebody has unipolar depression, bipolar depression. Are they cycling? Are they going through a mixed state of anxiety and depression? So what we generally say is, while we are trying to develop and find a diagnosis, you need to treat the person in front of you. Not the checklist, but treat the human being in front of you. Depression is depression. Yes, if it's a bipolar type depression, we have to use meds, we may change that. But rapport, establishing that connection with the person in front of you, listening to them, letting them know that you do care, showing that, they can pick up on that. That is 50% of the battle of saving a life. That's the advice I like to give to those of you who are therapists, those of you who are parents. And remember, it does not have to take you saying something. Sitting with somebody and saying, I'm here for you, and we just sit together in silence for 5 minutes can be powerful. Another issue we have sometimes is that our own ego as professionals. No, Dr. Lockhart said it's a bipolar patient, and no, that's what it is, and I'm going to fight with the other therapists, and they're saying no, and we need to put that aside again and realize that we're treating the patient, we're treating the human being. That's what we want to deal with. All right, challenges. Going back to the emergency room setting that we have right now, study after study after study, and again, quick Google search, you'll see this, point out that the emergency room setting is not the ideal place for anyone with a mental health or emotional challenge. Not only is it not the place, it actually makes things worse. It increases agitation, which then many times starts a process where the person then becomes medicated, sedated. They become even more angry. Sometimes their symptoms are exacerbated, and then guess what? In the end, they reject all treatment and pull away. One of the major stigmas that I had to fight here 20-something years ago was, first of all, being a psychiatrist. I remember, actually, before I even had a car, being picked up by a taxi driver and saying, what do you do? And I said, I'm a doctor. Oh, you work at the hospital? I said, well, I'm working at Christie Tomlinson. What type of doctor are you? Psychiatrist. What? I said, a psychiatrist. Oh my God, you're mad people, doctor. And there was a stigma left back because the physician that was here prior to me was overworked, overloaded. There was one psychiatrist for all 3 islands. So his treatment approach many times involved using medications and using injections primarily. And he was actually, they used his name and put injection after it. And people, and up to now, there's still somewhat of that stigma in our culture. So going back to talking about culture, that's something that we're well aware of here. And I make the point to people that although I'm a psychiatrist, I don't work for a drug company. I don't support any drug company. I use it if I have to. But if playing marbles on the ground with a patient is going to help them to feel better, I'll play marbles on the ground with them. That's why I told the young man, I don't hide from anybody. I'll go wherever and do whatever is needed to help our patients, our clients, and those that we come in contact with. And that's something I want you all to take with you. That's very powerful. That's the most powerful medication. That's what we want and crave as human beings, is to feel that we're part of something. That's why they're gangs. That's why we wear colors. That's why we love football teams. That's why and that sense of wanting to be a part of something and wanting to feel safe is much more pronounced in young people. So that's the secret that I want you all to tap into. What do you do when you leave here? How do I handle things? How do I talk to my child or my niece or my nephew that I know is cutting or that has a lot of anxiety? Spend time with them, sit with them. Let them know you really do care and you're there, you're not judging them. 50% of patients with a mental health type crisis leave emergency rooms when they feel that they're not getting the attention in a timely manner. Now, that sounds vague because you're going to say, okay, but how much time, what's the wait time? And that's the problem. that when we are going through an emergency psychiatric emotional type issue, time changes. That was part of what Terry was doing with you. The whole process of time changes. 5 minutes, 10 minutes is an extremely long time for somebody that has suicidal thoughts. That's where the crisis line is very valuable. We've started that process, but we need to amplify that. It needs to be 24 hours. Just this morning, listening to the same BBC program that I mentioned, they said that one study in the UK highlighted that the highest number of calls came in between 11 p.m. and 4 a.m. in the morning. So that's what we need to amplify. We need to also meet the young people where they are. And we heard that earlier in the talk in terms of we need to get into technology. We need to know how to use it. As treaters, we need to set up in what we're going to be talking about in our hub. Those of you that have the expertise in terms of going on Instagram and these different things and using those clever ads like what the inspector spoke about with the egg and coming up with other clever ways of reaching those in need to break down that barrier so that they don't have to wait 10 years before they seek treatment. There are better, less costly interventions to improve the emergency system that we have. And again, we spoke about this, but primarily it involves us getting together, doing exactly what we're doing today. It's fantastic to see how this whole process came together. And how it started was the wonderful work done by these wonderful ladies and team on the Panton Foundation. They started the process. They contacted the Mental Health Commission. We sat down and brainstormed and spent several hours one afternoon talking through things. We came up with the idea collectively to say, let's look at the National Drug Council that has that wherewithal to do this, to get this information. They contacted the National Drug Council. The National Drug Council then worked also with one of the members who's chair of the Health Services Authority, and Inspector Ashworth at MASH is contacted, and here we are with all this information. Private practitioners, and this is what we need to build on, with the public-private partnership. We've been saying this, you've been hearing these terms for 15, 20 years, and I think many of us now realize we have to act on it. And it takes a bit of sacrifice, but in the end, the information that we gather, the quality of the information is very vital, and it will manifest itself in actually helping tangibly those that need the help. So, collaboration, a triage system is what we want to set up. Meaning, let us address the problem with the right equipment at the right level in the right amount. You don't need a psychiatrist seeing a 10-year-old that's being bullied. You don't need to jump to that level. Let them see a social worker. Let them talk with someone. Let them see another type of a therapist that can spend time with them, and then gradually triage as is required. Another major issue is an emergency room setting is not the right setting. As we saw, percentages are high about trauma, and not just the trauma, and mental illness that originates, because we want to be careful. All mental illness doesn't come from trauma. The same brain that we're talking about can dysfunction. It happens to our heart, it happens to our kidneys, it happens to our liver. So many of us